We're now going to be looking at a treatment protocol for our pregnant patient who's in her second trimester of pregnancy. So remember I said that a patient who's in her second trimester of pregnancy is in her structural stage where she's anywhere between 12 and 28 weeks. Now, why do we call it the structural stage? Structural stage because this is the time during the pregnancy where the woman's structure, her alignment of her spine and her weight distribution from an anterior-posterior perspective is starting to shift and change. We talked about during the first trimester how there isn't really a lot of changes going on within the body. And when you're working with a patient who comes to see you in her first trimester, you want to assess and correct any problems that she might be having from an osteopathic viewpoint that she's carrying into the pregnancy. But now that your patient is moving into her second trimester, between 12 and 28 weeks, the fetus is starting to grow. There's starting to be some weight being pulled forward. And so we start seeing shifts in the posture of the patient. Specifically, this increasing new weight that is coming from the abdomen region is going to trigger a reflex reaction whereby her thoracic spine or the kyphosis region is going to increase somewhat. So what you'll start to have during that trimester is women reporting problems in her upper back, discomfort there, pain between her shoulder blades, and as we're going to see in our model today, actually already the beginnings of some lymphatic congestion in the thoracic region. Now, if the thoracic spine tends to shift and adapt to try to counter the weight of the baby, well, now obviously the cervical spine or the neck is also going to adapt and shift as well. So you can start having at this stage some headaches, some shoulder trapezius pain, some forward head posture, and some effects that are starting to come from increased or exaggerated curves within the spine. You'll also see possibly some problems within the lower back, within the lumbar spine, and so we're going to be also working on that particular area in order to ensure that any increased pressure that's starting to come from the lumbar area as a result of the changes in alignment of the structure of your patient are also mitigated so she's not walking around with a lot of pain and discomfort. So whereas in subsequent trimesters, when we'll see in the third and fourth, where the changes within the body are happening more on a cellular level, and we have more questions of lymphedema, congestion, and other symptoms, in the second trimester, we have primarily musculoskeletal pain because this is the trimester during which we're starting to have changes and shifts and adaptations within the spinal region and all of the changes and discomforts that come with it. So let's take a look at our protocol and you'll see just what I'm talking about. We're here today with Erica, who's in her second trimester of pregnancy, and we're going to talk a little bit about how she's feeling as she's in her second trimester of pregnancy, some of the symptoms that she's having, which will give you a bit of an indication of what you might come across during the second trimester of pregnancy, which we call the structural stage, and how you've already learned in this chapter how this is when the body starts to adapt and starts to change, the spine starts to adjust, and so your pregnant patient might start having certain symptoms related to her back or her chest or her neck. So Erica, how many weeks pregnant are you?
I am 22 weeks pregnant.
Okay, and I understand that you've decided to take off work throughout your pregnancy?
Yes.
And how is that going for you? Can I ask, why did you decide to do that?
Yes, I decided to take off work because I started to experience lower back pain about a month ago, and for me it's better to stay at home because I can rest a little bit more. Also, my breast is getting a little bit bigger very fast, and I feel that it's kind of pushing the weight in the front. So yes.
So you find that you're having some low back pain?
Yes.
And you feel that the weight of your breasts,
yes,
that your breasts are growing rather quickly even though you're still in your second trimester.
Yes.
Although advancing quite a bit closer to the third trimester, and you'll see, here's an example of how someone is already, the baby is showing quite a bit, her breasts are growing and engorging already. And so what we're going to want to do with her is help to relieve some of the shifts and adaptations that take place initially, of course, in the lumbar spine, But when we have shifts in the lumbar spine, it's going to automatically have an effect, as we saw on the thoracic spine and also on the cervical spine. And so our techniques are going to help to relieve some of the tension that might take place in the upper back area, but also in the neck, and how it might cause some forward head tension and also relieve some problems within the lower back. So are you ready to get on the table and we'll start working?
Yes, I am ready.
Great. So let's start.